All right, thanks for being with us. It is Wednesday, and we are live once again to the KGNS app. We're live to the website at kgns.tv. We're also live to our Facebook page this morning and our YouTube channel as well. By the way, if you've not subscribed to our YouTube channel, we are growing that channel. So I invite you to subscribe. We've got all sorts of content on there. It's different from the KGNS website in the sense that the content is just, I don't know how to say different. You're going to see some news stories on there, but you're also going to see some shows like Pop Off the Clock. You're going to get Foodie Friday, things like that, In Search of Miracles. So check out our YouTube channel and subscribe. We are going to, we've been celebrating anniversaries this year. It seems every Friday we celebrate United Way of Laredo celebrating their 75th, but Area Health Education Center is celebrating 30 years here in Laredo. Dr. Julie Bazan is the executive director for the Area Health Education Center, also known as AHEC. Julie, welcome back. How are you?
Great. Thank you, Ruben. It's so good to be here and to inspire the community to celebrate with us the 30 years.
I think you may be headed to 75 as well on the track you're going.
Oh,
right
wow.
now.
Well, we hope so. If the community continues to have the need for education and the activities that we bring here, of course, we will be here for 100 years and more.
Yeah, Julie, tell us a little bit about what...
Through continuing education programs, workshops, trainings, etc. Over the years, the Area Health Education Center Board and the staff, along with several representatives from the school districts, the college, and the university, developed a pathway of programs so that we could introduce students from the elementary to the college level to the many health careers available for them to choose from. And so now we have programs that introduce health careers to students, and many of them, we've been here 30 years, are now practicing providers in the community. And so in a nutshell, that's what we do, but we also work with the families by making accessible to them education that can prevent diseases that are very common in our area, and also talk to them about preventive measures for other types of illnesses.
Is the Area Health Education Center unique to Laredo, Julie, or is this a nationwide?
The Area Health Education Center is a nationwide program established in 1970s by Congress. So it is a national organization. However, our AHEC is one of 5 under the umbrella of the University of Texas. And we've been here since '93, and each AHEC is different depending on the resources in their community, depending on the needs of their community, because we are driven by what the community needs, what the community wants, and we collaborate with all social service agencies, healthcare institutions, educational institutions, and the newly profession that is a community health workers. That's a profession that's coming up, and they have provided valuable services to the community and the providers.
Now, a community health worker, would that be under the field of social work?
No, a community health worker is a 12-week training program that introduces, it is recognized by the state, and the person is certified as a community health worker to provide navigation services at providers' offices or places like Gateway Community Health Center. The health department employs them. We employ some. They're very, very important in the system, the healthcare system, because they assist in following up with the patients to make sure that they, in fact, took their medication, reminding about their appointments, conduct support groups for people that have those needs, and also navigate the system. So you asked me, is it like a social worker? They do a lot of the work that the social workers do, but it's not nowhere near the educational background that the social worker has.
Right. That's a pretty tall task, Julie, to oversee this area that is medically underserved and try to increase the amount of healthcare that is available here in the Gateway City. Over the last 30 years, how do you feel the mission has gone?
I strongly believe the mission has gone very well. We have exceeded the expectations of the board of the university, and just in the last 30 years, we have served over 105,500 students through our programs. Pathway programs is what we call them, and we have provided over 100 5,000 continuing education hours for the practicing providers through the many conferences and trainings. But then in addition to that, Ruben, remember I told you that we also work with the community at large. Over 318 plus people have been touched by the education to keep their families healthy and to make informed decisions about their health.
Now, is AHEC considered to be a nonprofit organization?
Yes, AHEC is a 501c3. So we wear two hats. We're under the University of Texas Health Science Center at San Antonio, but we're also 501c3. And that is something that the university required of us when we were established so that we can continue to seek funding to bring down resources and trainings for the community.
Dr. Julie Bazan is joining us this morning. She's the Executive Director for the Area Health Education Center. They are celebrating 30 years of service to this community. It's very wide-ranging work that you do, Julie. How do you manage to have all of your hands in these cookie jars and still be good at what you do?
And you know, Ruben, it takes a team to do the work, and not just the team that is employed at the Area Health Education Center, but also the partners in our community. We have developed very strong ties, very strong partnerships where we learn to leverage with one another the resources that we have and serve more people than you can imagine. And I think it's all about partnerships. It's all about understanding the role that each agency has in the community and how can we support one another. And so how do you stay in tune with all the projects? You just make yourself available to the needs of the community, and the community drives you.
Yeah, and I see you collaborate with a lot of organizations, so you do work with the other people in the community. That's crucial, right?
Yes, definitely. As you know, October is Domestic Violence Awareness Month, and we are very much a part of the Webb County Domestic Violence Coalition. And every year we do a conference on domestic violence. This year we're doing the 27th annual. And AHEC, along with other community agencies, Casa Misericordia, the District Attorney's Office, the Sheriff's Office, and many social service agencies, provide this one-day face-to-face at Texas A&M International University, where we bring the most important and most current legislative impact on domestic violence issues and different things for the client, for the perpetrator, for the families. And so we partner with many agencies for this one particular program. Again, over the years, we discovered that domestic violence education was not just for the adults. The earlier that you can educate our kids about it, the better. So 12 years ago, Ruben, we started the Youth Domestic Violence Conference. And we're having this one on Wednesday, October the 4th at 5:30. This one's spearheaded by our Webb County Attorney, Marco Montemayor, since he is the one that deals with the youth. And it provides 10 community service hours to all the students. We invite from middle school to high school to join us. It is a virtual conference, and it's only from 5:30 to 7, and the kids get community service hours. We have learned that when you educate our children at a younger age, they also become the advocate for their families when there are issues at home, and they know where to reach out for help.
So if they see something happening at home, they know where to go.
Exactly.
Wow. And how is the response from the youth? Do a lot of them seem interested in learning?
Excellent attendance. And, you know, once upon a time when we started this, it was a face-to-face conference. And we used to hold it at the UT building on Bartlett and Bustamante. When the pandemic hit, that we were introduced to the virtual platform, we began with the virtual youth domestic violence. What we discovered is that more students from other counties were able to connect. And so the committee decided to keep it virtual to allow students from Zapata, from Cotula, from Encinal, from wherever they are, even from the Valley, they can connect and learn. So the attendance has been impressive. The face-to-face average was 120, and the virtual is 170 plus.
Wow. Now, as of late, Julie, also something that you've been focusing on is this, there's this campaign for raising awareness with the 988 number that you are not alone. This is Suicide Awareness Month.
Correct.
So that's something else that you've been focusing on as well, correct?
That's another thing, Ruben, because the way we see it and we understand it is that it doesn't matter if you have the most prestigious education program in town to take advantage of. If you are not well physically and mentally, you will not be able to take advantage of those resources. So at the Area Health Education Center, we understand that the complete health of an individual is very, very important, and that includes your physical, your mental, and your spiritual health. So creating awareness about the 988 is, in essence, giving people an opportunity to learn about the resource to assist them when they're dealing with a crisis or need to talk to someone.
And again, it's getting them engaged, and then when they need help, getting them to the right people.
Yes, to the right people. That's correct.
Julie, you have this event coming up on Saturday. Let's talk about this. The 5K run and walk on Saturday. Tell us about this.
So the 5K Run Walk Health Fair is an event that we are doing to celebrate our 30 years of service to the community. And what better way than to bring people out, families out, and we invite all the families to come out and meet with the health and social service agencies. Many of them will be providing health services, health screenings, flu shots, vaccines, etc. To celebrate the 30 years. But in addition to that, we want people to come out and do some physical activity by just walking a short 1 mile or interacting with one another, networking. Studies have shown that also physical activity helps you deal and manage with your depression if there is any. But the most important and valuable thing about this event is that we are bringing all our partners together so that the people that visit this event can meet them and learn how valuable the services are that they provide. So it's a whole awareness about what's available in our community.
So it's twofold. You can actually take place in the 5K run and walk, and if you don't want to do that, then show up for the health fair.
Network and just come and have a good time. Yes, have a great time.
And so here's the information again. There is the QR code. If anybody would like to register for the 5K Run Walk, it's $35. That does include a free T-shirt to the first 100. Does that money go back into AHEC, Julie?
The money that we're raising for this 5K is for the scholarships for the students.
Gotcha.
Every year we give scholarships.
Okay, and this will be at North Central Park. And the race is from 8 to 11, right?
That is correct. And the health fair is going to be from 7 to 12. People can come and get their blood pressure, glucose, any kind of health services available. We invite them to come and take advantage of that.
I remember you mentioned flu shots as well, COVID shots.
Exactly.
I know that I believe I read, or we reported that you can get both the flu and the COVID at the same time.
Yes, you can, as long as you're not feeling sick.
Yeah. Julie, and talk about your staff. How many people make up AHEC here locally? So
the staff varies depending on the project or the grant that we're working on, but I am very, very proud to say that over the course of the last 12 years, I have had a total of 2 long-standing staff, Ms. Vicky Morales and Ms. Hazel Medellin, and they are just amazing. And as a matter of fact, they recently received their certification to teach the course for community health worker. So we have that training program at AHEC that people that want to become community health workers can do so. I've had as many as 22 people and as little as just 3 of us.
Wow. And you get all of that done?
Everything is done, and we do have a very, very active board that is composed of 21 members from the community, and these are representatives from the hospitals, the educational institutions, community leaders, you name it.
You know, and we've seen an increase, you know, at both at the schools here at the UT Education Center, Laredo. They're adding programs through their satellites that are of the medical field that were not here before. It's really you're starting to see that increase in medical offerings here, right?
Yes, what happens is the UT system has very, very many valuable programs that promote health careers and professions. But now with the UT Education and Research Center, under the leadership of Adriana Nunamaker, they're able to bring down some of these programs, and students can start the coursework here and understand that there's another step that they can take, either the master's or doctorate level. So it's an opportunity for students. It's a great development to our community. And of course, the resources are just incredible. So I'm really happy to see that happening.
30 years of service to the community, Julie. Anything else you want to talk about before I let you go?
Well, the only thing I want to say is thank you to the entire community for always being there to support our programs, for reaching out, and always being available to come and attend everything that we have to offer.
And don't forget, come celebrate with AHEC on Saturday. There's the information for you. Julie, God bless you. Thanks for all that you do.
Thank you, Ruben. You have a blessed day.
You too. All right. I got to go. I will see you on KGNS News at noon. I'm going to leave that flyer up there for you for a little bit if you want to scan the QR code, if you want to take part in the 5K run and walk. If not, just show up at North Central Park on Saturday to visit the health fair. All sorts of services available as well. I'm going to also zoom in below the QR code. You see the phone number if you're interested. That's the number to AHEC, right, Julie?
Yes.
Okay. So 956-712-0037. Thanks for watching. Have a blessed day.